Thank you, Dr. Bird. The information that you shared has such practical purposes for persons with Parkinson's disease and for anyone. My name is Mary Beth Argel, a young onset person diagnosed with Parkinson's disease at age 43. It is now my honor to invite Dr. Suketu Khandhar back to the stage and to introduce our keynote speaker. Dr. DrMathur, joining us remotely, is a family medicine physician outside of Toronto, Canada. She resigned from her practice 12 years ago after her diagnosis of young onset Parkinson's disease. She is now a dedicated speaker, writer, educator, and patient advocate. She works with the Michael J. Fox Foundation for Parkinson's Research on their Executive Scientific Advisory Board and the co-chair of their patient council. She serves on the boards of the Davis Phinney Foundation, the Brian Grant Foundation, and the Medical Advisory Board for the Parkinson's Canada. Dr. Mather has a special interest in helping educate the youngest affected by the stress of this chronic disease. To help facilitate dialogue between children and their loved ones, she has authored 2 books, My Grandpa's Shaky Hands and Shaky Hands, A Kid's Guide to Parkinson's Disease. Please enjoy the discussion between Dr. Khandhar and Dr. Mather.
Thank you so much, Mary Beth, for the lovely introduction. And thank you, Dr. Mather, for actually joining us here today, Zooming all the way from Toronto.
My pleasure.
So nice to see you. I think the last time I saw you, Sonia, was back in Kyoto when we were at the World Parkinson Congress last year.
Yeah, that was quite the conference. It's great.
So today we have quite a few questions that we're going to be asking of you as someone living with young onset Parkinson's. We here at the Parkinson Association felt that it'd be best to ask our young onset support group to give us questions that we then of course could ask you. So it's basically by the audience for the audience. So without further ado, let's begin. When did you share this diagnosis with your family or your workplace? And how did it affect your work and what went into the decision of stopping work? So maybe we'll start with the question about how did you share this diagnosis with your family and workplace?
Yeah, the question of disclosure is an interesting one, isn't it? It's something that's really individual for everyone. For me, I started off telling my closest family. A couple of sister-in-laws and my husband were the first to find out about my diagnosis just because I needed the support. But it took me about a decade before I actually disclosed to my wider social circle and friends, extended social circle. And that for me was for a couple of reasons. One, it was because I hadn't really come to a point of emotional acceptance for my diagnosis. It was really hard for me to accept that at age 28, I was diagnosed with a progressive neurodegenerative illness. And I also didn't want to be perceived in the workplace as being less capable, because unfortunately, there was at that time and still is a bit of social stigma attached with the diagnosis like Parkinson's when it really should not be, of course. And I felt that my patients wouldn't sort of trust my opinions or my work as much as they had in the past. So for those reasons, I kind of held off for a while, but it got to the point where I couldn't hide my symptoms anymore. And it was expending so much more energy, trying to hide them rather than just come clean, I guess, so to speak, and discuss my illness with other people. So it took me a while. I got there.
For the audience members that are not aware, at the time you were basically finishing and completing your residency as a medical doctor. And so with those long days, those long weeks, how were you able to basically navigate without having told anyone at the workplace that you had Parkinson's?
Yeah, well, I actually was diagnosed just as I finished my residency in family practice, and I was expecting my first child, so it wasn't the most convenient time to get a diagnosis. But the first few years of medical practice, as you can well understand, are busy times. So I was starting a new medical practice. I had the first of my 3 daughters, and building a new house, those sorts of things really sort of kept me busy. And it got to the point where I wasn't balancing it very well. As you know, also medicine kind of consumes your life. There's no really part-time medical practice. You just kind of put all that work into fewer hours if you try and go part-time. And being a mother was and is my passion. And I didn't want to give that less than 110% either. So what suffered was my health, and my self-care was non-existent. So it got to the point where one of the movement disorder specialists I was seeing at the time basically said to me, do you want to walk out of your office at the end of the day, or do you want to crawl out? It's up to you, but you can't continue on this path of trying to do everything and neglecting your health in the process. So that's what kind of led me to stop working at about, I think I was 12 or 13 years into my diagnosis at the time I stopped clinical practice.
So that's actually kind of leads to me into the next question, is that how did you balance having Parkinson's, working, and having a family at the same time? And you, after the time of diagnosis, you still worked for another decade and a few years.
Yeah. How did I do it? I didn't do it very well. That's because, as I mentioned, it's just so hard for me to find the time for self-care, which is really, really vital when it comes to managing Parkinson's disease. I was burning the candle at both ends, trying to fit everything in and trying to be the best doctor I could, the best mother I could, the best wife I could be, and really neglected myself in the process. So it wasn't very easy to do. I struggled with that balance, like I'm sure a lot of other people do. And prioritizing yourself is what I tell people that they have to do, that's paramount, that's vital in order to live well with this disease. So that balance has to be there. I just wasn't very good at it.
Which one Parkinson's symptoms bothers you the most, and what helps you deal with it?
That's a great question. As we know, there are motor symptoms in Parkinson's disease and non-motor symptoms. And the non-motor symptoms, if you poll people in the community, seem to be the most bothersome when it comes to affecting your quality of life. For me, my quality of life is most affected by the off periods that I experience, which can be unpredictable and sporadic. They can last, a few minutes, or they might last an hour or two. And that's basically when my medications stop working. So I get very stiff. I get very tremulous. I get anxiety also when that happens. So those off periods, I think, are the worst for me. And what I found is very helpful is routine. So making sure I take my medications regularly and on time, making sure that I exercise regularly, because I find if I don't exercise, my off periods are worse. If I don't sleep well, my off periods are worse. So sort of looking at those variables that I do have control over, such as my medications and lifestyle issues, that if I optimize them, really do help control those off periods.
Yeah, that's actually probably a good segue into the next question. You sort of being right there on the sidelines when it comes to what's new and innovative with Parkinson's, given that you are on the board of directors for the Davis Phinney Foundation, you also work with the Brian Grant Foundation, certainly with the Michael J. Fox Foundation, and also with the World Parkinson Congress. What new medications or treatments excite you the most as being the most promising for those living with PD?
Yeah, that's a really great question, and one I get asked a lot. And what I would say actually is, it's not so much the medication as the direction of research that I'm most excited about. When I first started in this sort of community, maybe over 20 years ago now, the talk was all about dopamine. It was all about replacing dopamine, how to get the dopamine to where it needs to be in order to relieve symptoms. Now the research landscape is so much more. We're not just talking about dopamine anymore. We're looking at Parkinson's as a whole body disease, not just a motor illness, but so much more. And so our understanding of the disease is increasing, and that's what excites me most, because you really can't cure what you don't know, right?
Very true.
So, sorry?
No, it's very true.
Yeah, so I think that increased understanding of the disease is what excites me the most, the out-of-the-box thinking. So we're not just sort of have our blinders on and saying, this is all about dopamine. This is what we have to do. So that out of the box thinking, looking at Parkinson's disease as a whole body disease and how it affects patients in terms of their quality of life, and also searching for that biomarker. That's also very exciting research to me. A biomarker, as you know, is an objective marker of this disease. It's like your glucometer checks for diabetes or your blood pressure checks for hypertension. That allows your physician to manage your disease based on an objective reading, as opposed to just what they see when you're in the office, which is just a point, of evaluation. Doesn't really reflect how you are in your own environment. And also is a very subjective thing in terms of you relaying your symptoms to your physician. So looking for an objective marker, I really am excited about, and I think that's what's going to really move us forward in terms of not just clinical management, where your doctor has something substantial that they can look at, but also in terms of research, right? If we know that a drug lowers some sort of marker in our blood, say, that can really propel us in the right direction when it comes to research. So there's, drugs that are coming down the pipeline that are either disease modifying or treating symptoms that are exciting, but it's really the direction and our view of Parkinson's disease and the cause of it and how to measure the disease, the fundamentals of, I guess, Parkinson's disease that excites me the most.
Now that we're on the topic of treatment, and I kind of going to group two questions here together. With someone living with young onset, would you advocate to starting levodopa early? And on top of that, would you advocate for considering deep brain stimulation early?
Those are great questions. Whenever I look at changing a treatment, either in myself or if I'm looking at other people in my community, the one sort of thing I hold true to is quality of life, because until there's a cure, it's all about quality of life and maximizing your quality of life. So any treatment changes I make, as I said, on my own, or that I see for friends of mine or other people in the patient community, I always ask that question: how's your quality of life? If your quality of life is good, then just leave it as it is. So if you're started on a medication that isn't levocarbidopa and you're fine with that, great. But if you get to the point where your symptoms are impinging on what your life experience should be, that's the time to make a change. And levocarbidopa, I think, that's the gold standard that we compare other medications to. It's been that way for well over 50 years. And unfortunately, we have the same gold standard drug that we did back then. But it works really well to control symptoms. There was a time that we thought that starting your medication or dopamine replacement might progress the disease faster, because they found that people were having to take more and more of it in order to control their symptoms. But we now know that that's really not the case, that your disease is worsening because it is a progressive illness, and that you're having to take more medication just to manage increasing symptoms. So because of that, I don't think there's any reason to hold off anymore when it comes to a dopamine replacement.
Now, what about deep brain stimulation?
Deep brain stimulation, I can, it's about quality of life. They've been asking me to do deep brain stimulation for quite a while, but I keep holding off because I feel my quality of life is really good on what I'm treating myself with now. But deep brain stimulation in the younger population has been supported by a couple of studies. One came out, I think, in 2014, the early STIM PD study, where they looked at patients that were getting deep brain stimulation early in their course of disease versus just staying on medication. And they found that there was less motor complications, better quality of life, and need for medication was less in the group that went for early DBS, as opposed to waiting and just being on medication. Right. And I think there was another study, a pilot study that just came out this summer, which showed pretty similar effects, that it seemed that the people that received DBS early were, again, less likely to have motor complications and less likely to need a lot of medications to control their symptoms compared to other people. And they're going to be doing a larger study to examine that further. But I guess my answer would be, so science seems to be starting to support that potentially may be helpful. And if the scientific studies come up showing that it actually does help slow the progression of the illness, then my answer might be different. But at this point in time, it's basically for you to look at your quality of life and judge whether or not you need to add different medications or you need to go the DBS route. It's not a simple decision. It's really more of an individual one.
And I appreciate you being candid about your own thoughts about DBS for yourself. That said, I actually wanted to ask another question about exercise. So this comes directly from, again, that young onset support group. I've noticed that the exercise programs for Parkinson's are available in my area and are geared towards the population most affected by Parkinson's, who are mostly retired, so they are scheduled during my work hours, not quite at the intensity level that is recommended for me. Have you experienced this challenge, and how do you address it?
Yes, exercise. That's everyone's favorite topic. Some love it, some don't like it so much, but exercise is really the most important thing that you can do as an individual with Parkinson's disease. If you want to optimize your symptoms and optimize your life experience. Really, exercise is that important. For myself, I agree. I think that it's difficult to navigate some of the exercise classes because the vast majority of people are not young onset patients. The vast majority are older sort of comrades, I guess, in the community. And so a lot of exercise classes are geared to that age group. The important thing that I found for myself was that, and you have to look at yourself and be honest about it. I mean, I like to exercise, but I don't love to exercise. It's not like, some people crave to go out for a run. That's not me. So you have to find something that you're interested in and that you can do on a daily basis, something that you can maintain, because there's no point in starting a class if you're not going to maintain it. It's the consistency that's most important. So for me, I find that I can't really go out of the house. If I have to actually get in the car and drive somewhere to go, I'm not going to do it. So you kind of find your own limitations. Accountability is really important for me. It's what drives me if I have to face somebody else and say I did or did not exercise. So what I had was I had a personal trainer come to the house initially so that they would sort of motivate me to keep going with a regular exercise routine. And now I've sort of graduated to the point where I work it into my daily schedule. It's first thing in the morning because I won't do it later on. And I exercise at home. I do Pilates, yoga, weights, and walk the dog and bike and things like that I enjoy and that I will do consistently.
So to kind of expand on that, do you ever involve your family in your exercise routine? And if you do it at home, are you using things like Zoom, particularly during this pandemic?
I think it's a great question. I do involve my family to some extent, but I like to exercise at 5:30 in the morning just because that's quiet. And
that's early.
No one really wants to get up with me at 5:30 in the morning. But I mean, we do as a family go on hikes and bike rides and things like that, which are enjoyable when the weather's good, which is not the whole year up here in Canada as opposed to where you are. So I do involve my family to a certain extent. Zoom is a great way to connect, particularly during this pandemic. I think that the lack of ability for people to travel to do their exercise classes or their physio or their massage therapy, things like that, have really taken its toll on people with Parkinson's disease, not to mention the social isolation. I mean, the socialization of these exercise classes is probably almost as important as the exercise itself, that feeling of group and belonging and the emotional support that comes with being in a group of like-minded people. So Zoom is an excellent way. And there are so many resources, so many excellent facilities that are giving classes or access to classes for Parkinson's. And unfortunately, we don't know how long this is going to last, this kind of isolation or restrictions in terms of activity. So I think it's important to maybe, try a few out and see what suits you in terms of time and effort and go for it.
That's kind of sort of what I tell my patients as well. And, not everyone has the capacity to be able to have a personal trainer come to the house or be able to, sort of exercise in a wide array of different exercise programs. But what's important is that individual actually do what they find most interesting, what they know they're going to be compliant with, and what actually suits their personality.
Absolutely. I mean, it can be dancing, it can be Tai Chi, it can be yoga, it can be kettlebell, Pilates. Walking is a great way to get exercise, whatever was within your capacity to do and maintain. I think the regularity of it is what's most important.
Fair enough. So I have another question, maybe a little bit difficult to answer. Many people have a difficult time asking for help. What suggestions do you have for someone that knows they need help, but isn't the type who feels comfortable asking?
This is going to be an answer that I know is the right thing to say, but not that I follow it myself because I'm terrible at asking for help. And I'll tell you why. It's not that I feel that asking for help is a weakness, because it's not. It's actually a smart thing to do to try and navigate what you need to get done by using the resources that you have around you. And that means having people help you. So I know it's not a weakness, it's actually a strength. But for myself, I always feel like I'm sort of losing a little bit to the disease if I ask for help. And that's just something I have to work on internally. I mean, we're all, as this disease progresses, so does our need for introspection. And that's something I have to work on. But I would say I've definitely noticed from a care partner or family or friend's perspective that there's a sense of helplessness on their part. They can't do anything to stop the progression of this disease. They can't cure you. So when you allow them to help in a certain way, that's a feeling of empowerment for them as well. You're giving them an opportunity to do something for you, and that actually makes them feel good about it. So I'm trying to look at it from that perspective as well, that not only are you getting the help you need, but you're actually helping them in a way by allowing them to do something concrete, which will give them that sort of feeling of empowerment to some extent.
Kind of along that line, you wrote 2 children's books on Parkinson's disease. One really geared towards the toddler population and one really geared towards the family. And many of you in the audience actually got that book as part of your registration, so I hope you've enjoyed it. What inspired you to write a children's book? And I'm assuming that you obviously got a lot of your family support in writing it and their family's help in writing it as well.
Yes, it was my children. I mean, I'm a big fan of children's books. I collected a bunch when my girls were growing up. Reading was a very integral part of our day, before bed and so forth. We did a lot of reading as a family. And I was always fascinated by, the process of writing and that sort of thing. So that's what kind of led to the first one. My father also had Parkinson's disease. So the first book was My Grandpa's Shaky Hands. That was kind of inspired by him and the fact that I saw my children really not notice anything was wrong with him in terms of his symptoms. That's not what they noticed. They noticed the good things about him, the things that they loved most about being with their grandfather. And the second book came when my children were a little bit older and were sort of getting to understand what Parkinson's disease was all about. And we're asking more questions about, the fundamentals of Parkinson's. Why did it happen? What can you do to help? What can they do to help? And so forth. So the second book, which is the one I think that the audience has received,
right,
was geared to their age group. So at that time, I think they were 6, 10, and 12, or around that, or maybe 8, 12, and 14. It's not really age specific, but it's geared for a little bit older in terms of children. And we all wrote it together. My daughters and I wrote it together, and I'd run, ideas past them, and they were involved with parts of the writing of the book as well. And that was really cathartic. It was really a great project to do, but it stemmed from my observation that particularly with my daughters, they fear the unknown. They're worried about things that they don't understand. So I think that being very open and honest with your kids and having that discussion is really important in terms of how they handle it, because really it affects the whole family. Our diagnosis isn't just for ourselves, it affects our whole family unit, particularly the children. So having that open dialogue and being able to explain things for their level of understanding, I think is really important. And that's what kind of inspired me to write the second book.
Well, I think that a lot of people are going to find that book inspirational and maybe use it as an opportunity to be able to share that diagnosis with their families.
Yeah, I hope so.
Since being diagnosed with Parkinson's, I've tried to be more informed about Parkinson's by connecting with different organizations, signing up for workshops, conferences, webinars, connecting with support groups, and joining exercise programs for Parkinson's. I'm learning a lot and I've met wonderful people in the Parkinson community. However, I also feel like I have been living in a Parkinson bubble. Do you have tips on how to live a more balanced life, focused not just on dealing with Parkinson's, but all of life?
That's a really interesting question. I think and I understand where that's coming from. I'll often say to my husband, I'm kind of PD'd out because this disease is ever present. It doesn't sort of take any time off. So it's always sort of affecting you and in the back of your mind. What I say to people and what I say to myself is that this disease doesn't define me. This diagnosis doesn't define me. If I were to ask my family, my friends, to write down, say, an adjective or a descriptor of what they would think would be suitable for me, it's not going to be Parkinson's patient. It's not going to be sick or ill or, disabled. It's going to be things like hopefully a good person or a great friend or a valuable colleague or, a fun mother. These are the descriptors. These are the roles that we play. These are the roles that are much more important in defining who we are other than Parkinson's disease. So I keep reminding myself of that I'm much more than this disease. I'm a lot of other roles in my life. And I think that's really important to have that kind of introspection, inner dialogue with yourself and remind yourself, this is just part of you. This doesn't have to be you. You're defined in so many more valuable ways than just your disease.
I really appreciate that because I think a lot of our audience needs to hear that, particularly from someone like you who's already lived it, to know that it doesn't have to define you, that maybe it can just sort of remain your shadow because it will be with you, but you can redefine yourself, or you can define yourself however you'd like to define yourself, and hopefully in a very positive way. How can Parkinson patients get more actively involved in research? I know that this has also been sort of something you've helped to promote over the last several years.
Yeah, participating in research is really, really a passion of mine. When I used to talk, when we were able to travel and talk to people in person, one of the questions I used to get or usually get is, so what's coming down? What are they working on? And I would say, well, they're working on such and such. But I began to realize that they aren't working. We as a community have to be responsible for the work that's being done. I mean, part of the problem is with clinical trials is that they're delayed. 80% of clinical trials are delayed because of recruitment issues. And up to 30% can end up not even recruiting a single person, which is a huge waste of time and resources. So clinical trial participation is really, really important. And that's something that we as a community need to understand, that we are part of the search for better treatments. We are part of the search for a cure. And without us, it can't proceed. Knowing that, I do know that there are a lot of myths and misconceptions out in the community about Parkinson's disease research or research in general. And I think that as patients, we need to educate ourselves on what being involved with research is all about. I mean, there are so many ways to become involved. It doesn't mean that you have necessarily, brain surgery as part of a research trial, though there are trials that are geared towards that. But there are simple things like, surveys online or one visit to do some blood work or to take a test or that sort of thing. Whatever is geared to your situation, your location, your time limits, your lifestyle, there's something that can fit you in terms of clinical trial involvement. And it's so very important. I would start off with asking your neurologist or movement disorder specialist that you see in their center what types of research they have going on that you might be involved with. And there are things online. There's clinicaltrials.gov, I guess, in the US that you could access for Parkinson's trials. There's Michael J. Fox Foundation's Fox Trial Finder, which is like a match.com service where they, depending on geographical location, will match you with trials that are taking place worldwide. So there's ways to get involved, but it's really important for you to consider supporting our research community so they can do the work that will ultimately benefit ourselves.
I agree, and it's not just about research that helps others, it's also self-empowerment too. I think that of my patients who have actually involved themselves in research, they feel like they're one step ahead of the game. They feel like they're contributing to something grander than just the care for themselves, but ultimately, like you said, it really will impact them as well and their family members. I also find that there's a certain personality that starts to develop in someone who actually is participating in research. They start being a little bit more routine with their medications, they start actually being more active in their exercise program, start being more connected to the community. And they're more than willing to share their experience with others who may actually be on the fence about whether they want to or not.
Right. I mean, I think that's where we can learn the most is from people that are already participating as patients that can sort of be the ambassadors for clinical trials in general. Absolutely.
Well, thank you. And everybody in the audience, please consider being part of research programs, even if it gets you to the PANC website, ask somebody, ask your local movement disorder neurologist, or even our academic centers locally here. So in the last minute that we have here, I want to ask the question I saved the best for last. What is the best part of having Parkinson's?
The best part of having Parkinson's. I'm hesitating only to sort of gather my thoughts because there's really a lot that I have learned about myself through this process. And all of those things have been, I mean, it's been much more of a blessing than a curse. I will say that. It's taught me to prioritize things, reprioritize what's really important in my life. That's something that I've really benefited from. It allowed me time to do so. Because although it sort of took my career away from me early on in terms of clinical work, it certainly allowed me to be there more for my children at a time that they needed me when they were growing up. And it certainly allowed me to pursue this role of advocacy in patient education and clinical trial enrollment. And it's things that I'm really passionate about. I feel like I found my life's passion in the work that I do. And it's been, as I said, more of a blessing than a curse. It's taught me that, we're going to face challenges in our life when it comes to not just this diagnosis, but many things. And it's really something we don't have necessarily control over, but how we react to those challenges, how we face those challenges that come up in our life really define the people that we are. And so I think that sort of development of me as a person and the lessons that I've learned from dealing with this challenge for now well over 22 years has really been the best thing for me. And I've always felt that this is sort of the trajectory my life was supposed to take. I wouldn't really change it for, obviously it'd be nice not to have Parkinson's, but I've never been a why me sort of person. It's why not me? I can learn from this experience, and I've learned a lot.
Thank you so much, Sonia, for your insights. Your life's been an inspiration, and I really appreciate you sharing this time with us here for our audience to appreciate what you've been through. So thank you so much. And I think that concludes our fireside chat.